This next hot headline was inspired by a question we received from one of our viewers.
I think people over age should pay more for health care. If they're not going to take the time to spend money to keeping fit and eat the right foods, absolutely they should pay more. Doctors, what do you think?
Well, I think that's a great question. I mean, obesity is the leading killer in this country. So, should obese Americans pay higher health care premiums, or is that discrimination? I mean,
I think it's discrimination.
I think they should. We are charging, what, like $11 for a pack of cigarettes? We're taxing the hell out of it. So the thing is, we are all paying for this. And when you're a crappy driver, they raise your premiums.
Well, that's...
Wait, rewind. Healthcare costs have skyrocketed, and it's costing us $150 billion a year because of the obesity epidemic. But I would contest that the obesity epidemic has been caused by profiteering companies who are making our population obese. Let them pay the extra health care costs because obese people are already paying a huge cost.
But wait a minute, you guys, it's still a choice.
Why not make it more like, you touched on it, auto insurance.
Right.
If you're a good driver, you don't have any accidents, you don't smoke, etc., you pay less.
But that's different.
How is that different?
That's because I agree with that.
That's what happen.
But that's the same thing.
No, it's not.
We're not.
It's not, right, Dr. Lisa? Because you're rewarding good behavior versus punishing bad behavior.
Honey, it's the same exact thing. You're healthy, you pay less. You make bad choices with your health, you pay more.
Taxing cigarettes
Yes.
worked. The rate of cigarette smokers has declined quite a bit. We are afraid in this country to tax foods that we know are killing our kids and our parents. And I'll tell you right now in the emergency department, it is a lonely place when you're seeing patient after patient after patient morbidly obese. Do you think it's really going to help if on top of that, when they come in sick and already poor, living in a health food desert, that, and you have to pay an extra $100 a month, because you're obese.
They're already victimized, Travis. You're
They
right.
are.
They're already
I don't
victimized.
believe they're victimized, you guys. I do believe that they have less access, and that's why we have to work harder to get certain laws passed that make healthier food more accessible. But with that said, they're not victims.
And what
they make
about
a
the people, though,
choice
who just have a genetic predisposition towards weight gain and obesity?
No such thing.
I will tell you
There's
this.
not one person I have not been able to make healthy, no matter what their genetics
So
might be.
Jillian, if
Genetics
someone
are
had,
dynamic.
Dr. Lisa, I want you to comment on
Guys,
this.
genetics are
Listen,
dynamic,
Jillian.
and you know that. They're affected by the way you live and the way that you eat.
I'm going to let Dr. Lisa comment on this.
Okay.
A woman has, say, low thyroid hormone, and she is obese because of a medical condition. Are we going to make her pay more?
I had low thyroid hormone.
Right,
Am I obese?
and you had it taken care of.
Actually, I changed my diet, and I managed to get myself healthy. And thyroid makes you 15 pounds overweight, not 100, 200, 300 pounds overweight.
I want to hear Lisa's answer.
Sometimes you can't necessarily exclude it as a disease because sometimes it also comes with depression and things like that. There are a whole host of things that are going to be contributing to obesity, and we can't, it is a discrimination because where do you draw the line between obesity and other things as far as increasing somebody's, health insurance?
As soon as you make a law like this, obese people, and many of them are living near the poverty line or below the poverty line. That's the only unhealthy food, low in nutrition, high in junk that they can afford. They're going to not buy health insurance because now it's too expensive. So now they're going to take the most expensive kind of health care possible, emergency room medicine. And they are going to show up at emergency rooms with no health insurance and have to be taken care of.